The landscape of cancer treatments is on the brink of a revolution. With the rise of mRNA vaccines, it seems the future is bright. Let's journey back in time to the early 2000s. The dawn of the millennium saw the advent of preventative vaccines for certain cancers. Just as the HPV vaccine prevents cervical cancer triggered by high-risk papillomaviruses, these vaccines target infections that could potentially lead to cancer. The virus doesn't directly cause cancer, but it can lead to precancerous stages if it permanently settles in the mucosal cells. Another preventative vaccine is the one against hepatitis B viruses, which can lead to liver tumors in cases of chronic hepatitis B. According to the German Cancer Research Center, about 4% of all cancers in industrialized countries stem from viral or bacterial infections. This rate is even higher in developing countries. As we move forward in time, we find ourselves in the era of therapeutic vaccines. These are the subject of intense research, and one such vaccine is the therapeutic mRNA vaccine, which is used to treat existing cancer diseases. mRNA vaccines, which became a common term during the COVID pandemic, are particularly adept at training the immune system to battle tumor cells. They can teach the immune system to detect cancer cells and swiftly eliminate them, with the side effects generally being classified as relatively harmless. Suzanne Weg-Remmers from the German Cancer Information Service points out that for this vaccine to work, certain conditions must be met. According to current knowledge, mRNA vaccines could be an option, especially if tumor tissue has been largely removed by surgery. In this case, along with other active substances, the mRNA vaccine can help eliminate cancer cells that could still be present in the body and lead to recurrence. Therefore, mRNA vaccination could increase the chances of recovery for more patients. This method allows doctors to tailor the therapy to the individual characteristics of the tumor. The mRNA vaccine against cancer is based on the same foundation as the mRNA vaccines against SARS-CoV-2. When developing a vaccine against cancer cells, doctors use what are known as tumor antigens. These are characteristics that are either not present or less present on healthy cells. The patient is given a vaccine that triggers an immune response against these tumor antigens. The aim is to teach the immune system to defend itself against cells with these antigens. Researchers have started to achieve successes in early clinical trials, for example, with therapeutic mRNA vaccination in malignant melanoma, a type of skin cancer. A large international clinical trial involving 1,000 patients is planned for 2024 for therapy with malignant melanoma mRNA. This study will lay the groundwork for future licensing. Other cancers that research is focusing on include bowel cancer and lung cancer, which are among the most common types of cancer. But remember, it's important not to expect miracles from the vaccine. The fight against cancer is a complex one, and while these developments are promising, they are just one piece of the puzzle. So, what's the takeaway? Stay informed. Stay hopeful. The future of cancer treatment is evolving, and with the potential of mRNA vaccines, we might be closer to a breakthrough than ever before.